Menopause is one point in a continuum of life stages for women and marks the end of their reproductive years. This is caused by the loss of ovarian follicular function and a decline in circulating blood estrogen levels. The hormonal changes associated with menopause can affect physical, emotional, mental, and social well-being. The symptoms experienced during and following the menopausal transition vary substantially from person to person. Symptoms include hot flushes and night sweats, changes in the regularity and flow of menstrual cycle, culminating in a cessation of menstruation, vaginal dryness, pain during sexual intercourse, and incontinence, difficulty sleeping, which is also called insomnia, and of course changes in mood, depression, and anxiety. In addressing these very challenging symptoms, lifestyle medicine, which is a medical specialty that uses lifestyle interventions as a primary modality to treat and prevent chronic conditions, is being promoted as it addresses the lifestyle factors that contribute to menopausal symptoms. Lifestyle medicine recognizes that healthy behaviors, starting with self-care, eating a high-fiber diet, in plant-based foods, getting adequate movement, avoiding risky substances, attending to sleep and stress, and engaging with others are the foundations of health. Today on your regular Health TV talk show, The Physicians, we will be discussing the role of lifestyle medicine in managing menopausal challenges. Stay tuned. It's another day with The Physicians, where health is our business. My name is Dr. Martina Agbere, your regular anchor on this program. And with me, as always, is my very intelligent and, of course, our celebrity shrink, Dr.
I'm Dr. Memona Yusuf Kadru. Welcome to your favorite Health TV talk show, The Physicians, where your health is our business.
And will always remain our business. Talking about the role of lifestyle medicine in managing the challenges that come with menopause. I'm actually very excited that we're going to be talking about this, because in the past weeks, months, years, we've been talking about the challenges of menopause. And it's been so daunting and making a lot of people feel, what kind of wahala is this? Okay? And talking about lifestyle medicine, the role that it has to play in managing menopause. What do you think? Because maybe I shouldn't even be asking you that, because you probably won't have experienced the things.
You don't have to experience it for you to know what it is. That's just the truth. But for me, I think we are not talking about menopause enough. That is the very first thing I'm going to take away from this conversation. There's a lot of focus on menarche, your first period, and all that with regards to as a girl, transit. Yeah. But focus on premenopausal and the real menopause. A lot of us are not having that discussion, and that is a big issue, because as a psychiatrist, I strongly believe people also have to start building their mindset towards that phase, because it can come in any way. People lose hair, people have big nose, people grow big, like things that are very out of place.
But I totally agree with you that enough is not being said about menopause.
No, we're not.
All we know about women are the menarche, then the next thing,
pregnancy, maternity, delivery, you know,
nobody even remembers that it gets a stage where...
And let us take it at this point. There's no whatever, because women have menopause, men have to have andropause. Yes. So this doesn't work that way. So that is why I'm emphasizing that this discussion, we need to keep talking about it more.
Yes. We need to keep talking about it more, because enough, we're not doing a lot. Women need to actually know and prepare for it. We're back after the short break. Stay tuned. Welcome to your favorite health TV talk show, The Physicians, where your health is our business. Today we'll be discussing the role of lifestyle medicine in managing the challenges that come with menopause. And in the studio with me to do this justice is no other person than a consultant gynecologist and of course an international board certified lifestyle medicine physician. She will be talking about the role of lifestyle medicine in managing menopausal challenges. She is Dr. Olufunmilola Mojoyinola. Doctor, you're welcome to our program.
Thank you. So glad to be here.
You're welcome.
It's nice. You look really good and smiling.
Thank you. No sign of menopause.
And you don't look like anybody's expecting.
It's not written on anybody's face.
It's not usually written. And I'm actually glad having you as our guest today. Because you know what, a lot has been going on with women, menopausal women especially. And in the last weeks, we've been talking so much about menopause, even on this program, talking so much about menopause. And different topics that we actually have handled. Somehow, menopause also comes up. And it's just on our faces, the challenges that we go through as menopausal women. So today we have decided that we'll discuss it. What are the ways, not with medication, what are the ways that women can actually use, and the ways that families or the husbands, men can support the women to go through this phase, because it's a big phase on its own. So let's start with the definition. What is menopause?
Menopause has different meanings to different people. But the actual thing is that when you're talking about menopause, just like when we talk about menarche for girls, menopause is when the woman has not experienced menstrual flow for a period of 12 months. So if peradventure you've had 6 months of no flow, if it comes up, that means that you're starting to count all over again. So 12 straight months of cessation of menses is what menopause is. And actually, people experience different stages even before they get to menopause. But that is actual menopause. So we have premenopausal, perimenopausal, menopause, postmenopausal.
I think it's good for you to break it down.
Menopause.
And yes, so people can know what the difference is. Yeah.
So the first one is actually the premenopause. And surprisingly, it comes as early as like 35 years.
Millennials will come for you.
Yes.
At 35, that's still a millennial.
You see some women going through all sorts of symptoms. Like you would have seen them in the clinic. Oh, they would have all these depression, mood swings, anger, all sorts of things. And the long and short of it is that the hormones are actually the ones working. So we have that early age, early onset. Some may not come up to like in their 40s, but you could have it start off from like age 35. That is the premenopause. And then you have the peri, which is around menopause. And that's like 45, 48 years, because actual average year of menopause is like age 51, 52. That is average. But you could have people having it earlier. So we have that perimenopause, which is around the menopause. And then the woman enters menopause. Like I said, a whole year without seeing a period. Once that happens, afterwards you have post-menopause.
So when it's good we are trying to get into what menopause is and all that and the symptoms before we get into the lifestyle. This is for us to just elicit those symptoms that menopause poses. And what is the role of lifestyle medicine in managing those common menopausal symptoms, like hot flushes, like mood swings?
There are so many. You know that estrogen is almost involved in all the cells of the body, because that's what gives the woman a shape, makes her who she is, actually. And you have 3 different types of estrogen. But the estrogen that we're talking about at this period is the one that is E1 estrol, which is the one for menopause. And this could go from head to toe. You have apart from the vasomotor popular one, you have, which are the hot flashes, you have people from mental health, depression, to anxiety, mood swing. The woman is laughing, and all of a sudden, she's
Right.
just there. Like, what's the matter? You know? And then you have, going from head to toe, you could have hypo, you could have hyperthyroidism. This also shows up along the line, which could actually be the, apart from the fact that the woman is having the symptoms of menopause, she could actually have some hypo or hyperthyroid symptoms, which needs to be spelled out using some investigations as at that. You have issues with dryness. You could have dryness in the vagina. You have the bone density being reduced. You have women tending to have osteoporosis, osteopenia, if it is not well managed. And then you have those with, like I said, the middle age spread. You have that is adding extra fat. Could actually add weight at this period, with or without anything you're doing. You could add weight. Then you go to the reproductive aspect. Oh, you have the dryness of the vagina. You have the what's it called? You have reduction in libido. There's no interest whatsoever. And funny enough, you have the men coming up at that level, and then you have the women going down. So there's really, yes, there's real need for education and enlightenment. You have brain fog, you're fatigued, you just see that loss of interest in some common things. So it actually goes all around, and there's need to be sure that it is not anything outside menopause, because it actually mimics a lot of other things.
All these ones that you have listed, like the symptoms, okay? And I don't want to say it's not scary. It's just that it's very inconveniencing for a lot of women. And so that you have some people now saying, I can't wait, this period is getting that, I can't wait for menopause. So when they hear the story of menopause, is this how this thing is? Nobody told me about it. So maybe growing up, the way we enlighten our daughters about menarche and the reproductive process, maybe we should also consider doing something with menopause, so you don't end at the point of just menarche, your first period, going close to a man. This is what you'll experience as you progress. So the person is prepared. So now let's talk about the role of lifestyle medicine. How exactly, how does lifestyle affect menopause, and tell us the role of lifestyle medicine in managing this challenge?
Okay, for quite a number of people, they'll be wondering what is lifestyle medicine. Actually, lifestyle medicine is an upcoming field of medicine where you use alternative to drugs in solving chronic diseases, chronic issues, mention any disease whatsoever, and is evidence-based. So we use our 6 pillars. We have 6 pillars of lifestyle medicine, and we use the acronyms DREAMS. So D for diet, R for restful sleep, E for exercise, S for A for avoiding toxic substances, M for mental wellness, and S for social connectedness. So those are our 6 pillars. So all these pillars work together to actually help in managing the symptoms of menopause. And if I have to break them one by one, talk about diet. Diet, you talk about whole food, plant-based diet. Gone are the days where you eat junks and you want to have the same result. So you want to talk about eating healthy, eating as much as possible, the food to be close to nature. Let it be as natural as possible. You want to go away from processed food. Even as you age, your body needs those ingredients. You don't need the processed food. So diet is a key part of lifestyle modification. What you eat matters. Actually, the saying goes, you are what you eat. And so it is very important to watch what we put, not just what we eat, what we also drink. Because whatever we put in the mouth has a lot to do with regulating our bodies and then help in assisting with the hormonal symptoms. Talking about R is restful sleep. You know, a lot of us, we lie down, but we don't sleep. We close our eyes, but we don't sleep. sleep has been seen to be a very important factor in helping a lot of conditions, medical conditions. And when we talk about sleep, we're talking about restorative sleep, because we sleep, but we're not restored. Imagine you waking up in the morning and wondering, did I actually sleep? It's because you actually just closed your eyes. So there are a lot of things that comes with sleep. We have things that we identify as sleep hygiene, where you sleep, the time you sleep, the surface on which you sleep, the environment in which you sleep in. Do you bring gadgets close to your bed? Do you eat close to bedtime? There are rules and regulations to sleep that actually will give you restorative sleep. And the average hours of sleep should be 7 hours, 7 continuous hours. The break can be just to ease yourself and come back to bed, but it's not in breaking the sleep. So sleep has rules, and when you follow the rules of sleep, it actually gives you. And you know one thing, I used to say that the sleep time is when the let me see, the LOMA, LOMA for Lagos State, the waste management. If you think you want to detox, which a number of women experiencing menopause would like to do, sleep is a form of detox. So when you deprive yourself of sleep, you're actually adding a lot of toxins to your body.
But I read somewhere that they said women, we actually need more sleep than men. Not because of anything, because of a lot of the activities we do, our lifestyle, societal expectation. We need that continuous, deep, uninterrupted sleep.
And even for mental health, sleep is key. It's been seen that the more you are able to achieve this restorative sleep, the lesser the brain fog, the lesser the depression, is being proven. So there's need for that restorative sleep, minimum of 7 hours. And then you have the next R, after R, is exercise. We need to be physically active. Achieving 10,000 steps a day is what we should target.
It looks so easy. So, like, we preach that every day here, but
yes.
I think,
but there are ways in which you put these steps into place. As much as possible. Yes, like I said, it's around the midlife period. A lot of us are like going to the peak of our career. So you have people attending to you. You have all the domestic people around you. So you tend to be very, sedentary. And you know that sedentary lifestyle has been equated to smoking. Smoking. So you don't want to smoke. So why are you doing things that are making you feel like you're smoking? So add steps. Get an extra step. If you are getting close to where you're going to, let your driver drop you some steps away or a few meters away and walk there. If you have the escalator or elevator, take the stairs. If you need to get something and you have services around you, take that extra effort to get up and do it yourself and target as many steps. And if I can give you a rough idea, yes, I wear this and I use it to monitor myself. My average walking hours, when I go in the morning till evening, I don't do more than like 3,000-4,000. And mind you, as a gynae, when I'm walking, I'm on my feet. It's not that I'm really, really sitting down. So you have to be intentional to make. So for me to make up to the 10, I get home and I add more steps.
Exactly.
That is it. So it's when I go marketing, that's when I say, oh, you're close to it. Oh, you make 10,000. And the watch will clap for you that, yes, you made it today. So we really need to be intentional about exercise. And mind you, let me just say here that sweeping and washing plates and cooking are physical activities. They are not exercise. They do not add up to what. Exercise is something you do repeatedly, same motion. So it's not washing or doing all those house chores that adds up to your physical.
No, but so there's that argument that people say, oh, doctor, you're saying I should go and do physical as well, hit up to my 10,000 steps. And in the workplace, I walk around a lot. I do many steps. Do you still, if I hit 10,000 in the workplace, must I get back home and also?
No, your 10,000 in the workplace adds up to what you do. But in addition to that, you know that, yes, before I leave this, very, very important. It's been proven by research that menopausal symptoms can actually be relieved by adding strength training. So it's not all about aerobics. It's not all about HIIT. It's not all about cardio exercises. No, we have others. You have the flexibility. You have you have yoga. You have Pilates, Tai Chi. Mention them. But for someone in this period of life that we're talking about, there's need to add strength training, and that should be like at least 2 to 3 times a week, while your routine other aerobics should be about 5 times a week.
When you say strength training, like example of
strength training means you either use equipment or you use your body. So when we're talking about using equipment, we're talking about using dumbbells, actually carrying weight, and people should not have this misinformation. I'm not ready to build muscle. You need muscle when you are in this period, because over time your level of your muscular percentage is going to go down, and that is part of what gives all these symptoms. You see some grandmas bent over and things like that. So you need to build those muscles to be able to take you through the period of menopause. So strength training with carrying of weight or using your body, like doing things like press up, sit up, you know, all those squats, and those are physical ones that you may not need to use weight. But in any way, you need strength training 2 to 3 times a week, while the normal aerobics is about 5 times a week, nothing less than 30 minutes.
How about the A?
A.
Yes, you're talking about the
avoiding toxic substances. Wow. When we talk of toxic substances, they are endless. Everything we tend to touch or you know, see around us is toxic one way or the other. But the popular one, we talk about tobacco, we talk about alcohol, we talk about caffeine. And for caffeine is not toxic on its own, but the way we take it can make it toxic. It affects our sleep. So it's been advised that we should actually have caffeine. If you are like someone like me that like taking coffee, would want to put caffeine at least 8 hours before sleep, because that is as long as that metabolism can occur in our body. And then you want to avoid anything that, things that we put on our body. Now that is very important, because we're talking about women here. And talking about women, a lot of us can't do without. You know that the average American woman is said to use almost 160 toxic substances on our body per day.
From cream, hair cream, perfume,
mention
body cream,
it. Yes.
Yeah.
Even our sprays.
Yeah.
Yes, we get exposed. And you know that the largest organ in our body is the skin. And we put so many things on the skin which are toxic and which are phytoestrogens. These are things that further worsen the effect of menopause on our system. And the M,
which is mental health. So that the question I want to ask with regards to the M is the fact that at what stage do the post-menopausal and post-menopausal women tend to see the psychiatrist with regards to using the role of lifestyle?
Yes.
Because that's a big issue when it comes to
because ordinarily they wouldn't go to the psychiatrist. They wouldn't go there. So the key thing is for the woman seeing a gynecologist, and the gynecologist having to be able to differentiate that this is more than menopause. This has gotten to the level of a psychiatrist having to attend to and that is why I will pride myself that I am on both sides. You see me, you see menopause, you see me, you see lifestyle. And we'll be able to differentiate. Really, on a lighter note, it's better for the gynecologist to see and be able to say, you need to see.
So the last one is the
S. S is social connectedness. This is social connection. We are also glued to our phones, and we think social media is social connectedness. No, when we talk of social connectedness, we're talking about physical social connectedness. Let's meet, let's hug, let's talk, and let's be together.
And studies have actually shown that the more we meet as women together helps to promote better health, makes you happier and of course healthier.
Those in the very the blue zones, the blue zones of the world, those are areas where you have people living very long life. They've seen that one of the things that keep them long life is the fact that they have communal living, so social connected.
Wow. Doctor. In fact, the way you broke this thing down to the grassroots, right? The understanding, anyone who is actually menopausal now, or even those that are looking that are not menopausal, like Dr. Memuna, they will be looking forward to entering that phase right now. They'll be looking forward to entering that phase. And for those that are menopausal now, listening to what you have said, it has given them a lot of ginger that they can actually survive with. So thank you so much for coming on our program, and we look forward to having you again to come and tell us more other things that we can actually do, not menopause again, more about lifestyle medicine and how it can help improve chronic diseases. Thank you so much. And to our viewers out there, you have heard it from Doctor, what she has said. The only thing I will add is for us to remember, if you are menopausal, remember dreams, dreams, dreams. D for diet, R for restorative sleep, A to avoid alcohol, avoid substances, then E for exercise. We always say it, if we put the benefits of exercising as a pill, it will be the best sold pill in the world. Then M for mental health. You don't want to see Dr. Memuna, mental health. Ensure your mental health is peak. And finally, social connectedness. You have to do that. So thank you for keeping a date with us again. Till next time, my name is Dr. Martina Agberie. Stay blessed.
Thank you so much, Dr. Olufunmilola. That was so brilliant, you know, being in the part of gynecologist and a lifestyle medicine practitioner, it makes it so easy to understand and relate. And to all our viewers out there, thank you for keeping a date with us. If you've ever missed any of our programs, please go to our YouTube page and watch over 300 videos we have there for you. Binge on it and be kind to follow us on all our various social media platforms. My name still remains Dr. Memuna Yusuf Kadri.
Thank you. His papa.